Innovations in illumination technology in modern surgical microscopes are aimed at providing excellent red reflex throughout cataract surgical procedures as it enhances contrast and depth perception. Stereoscopic coaxial illumination in Zeiss Lumera microscopes, coax 4 illumination in Leica Provio microscopes, and indigenous Omniclo device by Dr. Kakadia are some of the examples of these innovations. In Zeiss Lumera microscopes used in cases depicted here, the light source is split into 3 illumination beams. There are 2 separate illumination beam angles that can be separately combined or switched off. First beam provides 6-degree oblique field illumination, while second provides coaxial illumination. The latter is subdivided into 2 separate coaxial lights for providing 0-degree illumination at each ocular as depicted in the figure. The oblique beam can be progressively reduced by changing the aperture of the shutter. This can be achieved by turning the shutter knob. In majority of cases, both coaxial and oblique illumination is kept on, as seen in position 2 of the shutter knob. Turning it to position 1 blocks the oblique illumination, making the red reflex more appreciable, while turning to position 3 blocks the coaxial illumination. While position 4 provides pupillary block to avoid phototoxicity during surface surgery. Let us look at some clinical examples. The first case is that of near total cataract. We could perform Capsulorhexis without staining the capsule, as turning the knob into position 1 provides excellent red reflex. Fluid wave can be clearly seen as hydrodissection is performed. In the second case of mature cataract, even after staining the anterior capsule with trypan blue, red reflex illumination provides better contrast not just for rhexis but also for hydrodissection. The fluid wave can be appreciated very well in this setting. The third case is that of dense corneal opacity following removal of pterygium encroaching on pupillary axis in a case of dense nuclear cataract. Switching off oblique illumination by turning the knob in position 1 provides excellent red reflex while performing capsulorhexis. Capsular staining was done with trypan blue, which helped in visualization in this case. One can appreciate superior contrast provided while performing the rhexis in area of corneal opacity. Fluid wave during hydrodissection is easily appreciated. Vertical chop technique is performed for nucleus removal. Majority of chopping is performed in area of corneal opacity. Red reflex illumination helps the surgeon to clearly visualize the depth as well as appreciate the red reflex when the nuclear pieces are completely split. As one can imagine, it would be extremely challenging in such a case of dense corneal opacity in absence of superior red reflex illumination. As each nuclear piece is brought into anterior chamber and emulsified, the visualization is quite clear even though there is dense corneal opacity where the nuclear pieces are tackled. Such maneuvers would be extremely challenging in absence of red reflex illumination. Once all the nuclear pieces are removed, Hydroblast procedure is done to loosen the cortex. Visualization of the cortex is much clearer under red reflex illumination. Bimanual cortical cleanup is performed. And anterior capsular polishing can also be done easily. The IOL is implanted in the bag and viscoelastic wash is done with bimanual technique. The visualization is excellent at each and every step of surgery despite the dense corneal opacity. In the next case, the cortical fibers adherent to posterior capsule are better visualized under red reflex illumination, and PC polishing is done much more safely. The red reflex illumination can also be effectively used to confirm centration of IOL, covering of IOL with capsulorhexis margin, as well as appropriate placement of toric IOL in desired axis to confirm appropriate alignment. In summary, innovations in illumination technology in modern microscopes enhance visualization by providing better red reflex and thus enhancing contrast and depth perception, surgical safety. Thank you.